Radioactive contamination in Coldwater Creek in North County, St. Louis, an examination of high rates of cancer and ways physicians can help. During your years in med school and residency, I'm sure the phrase, "when you hear hoofbeats, think horses, not zebras," was drilled into your mind. However, due to radioactive contamination throughout St. Louis, sometimes you may in fact encounter zebras. In 1945, 43,000 tons of radioactive waste was produced in St. Louis as a result of the city's involvement in refining uranium for the Manhattan Project. After the war, the chemical waste produced was moved to the St. Louis airport and was left adjacent to Coldwater Creek in uncovered containers. Over time, the improper storage, as well as natural forces such as wind and rain, moved some of the waste and contaminated both the creek and surrounding areas. Eventually, the contaminants were moved again to Westlake Landfill. At the time, residents who frequently used the creek recreationally also likely had prolonged exposure. Additionally, residents relying on locally grown vegetation and dairy products at the time could have been exposed through food sources. In response to growing recognition and concern for the contamination of the creek area, the Agency for Toxic Substances and Disease Registry completed a public health assessment in 2015. The ATSDR assessment focused on 3 of the prominent radiological chemical contaminants in Coldwater Creek: thorium-230, radium-226, and uranium-238. Here's a map specifically focusing on Coldwater Creek. The red highlights areas where soil sampling and surveys have identified contaminated soil. These areas require additional restoration. The Missouri Department of Health and Human Services study identified 28 forms of cancer present in the 8 zip codes surrounding the creek from 1991 to 2011. They determined that there were 4.7% more cancer cases in the combined zip codes than expected based on state rates. This map shows 5 zip codes that are directly touching Coldwater Creek and are therefore more likely to have experienced the highest exposure to the radiological contamination. All of these zip codes are marked as areas that show statistically significant and higher than expected rates of cancer. In zip code 63031, there were 66.09 more cases of lung and other pulmonary-related cancers than expected based on statewide cancer levels. There were 59.43 more cases of prostate malignancies than expected, and there were 32.82 more cases of urinary bladder cancer than expected. In zip code 63033, there were 63.84 more cases of breast cancer among female patients than expected, and there were 148.05 more cases of prostate malignancies than expected. In zip code 63042, there were 33.1 more cases of breast cancer in female patients than expected, there were 27.6 more cases of prostate malignancies than expected, and there were 41.97 more cases of lung and other pulmonary-related cancers than expected. In zip code 63134, there were 64.74 more cases of lung and other pulmonary-related cancers than expected. There were 31.42 more cases of breast cancer in female patients than expected. There were 19.5 more cases of rectum, anus, and rectosigmoid malignancies than expected. There were 8.96 more cases of liver cancer than expected, and there were 15.62 more cases of larynx cancer than expected. This radioactive contamination is also correlated with negative impacts to children's health. In zip code 63034, there were 18 cases of malignancies in children, despite the expected number of cases only being 11.4. Specifically examining brain and neurological cancers, there were 7 observed cases in children, which is almost triple the expected number. With the information provided by the Missouri Health and Human Services study, as well as additional information provided by the ATSDR assessment, we believe that it's vital for physicians in North County and the broader St. Louis area to have an increased index of suspicion for cancer among patients who are from or currently live in the identified high-risk zip codes. Physicians can help residents of Coldwater Creek through the following actions. First, physicians can educate their peers and coworkers about the history of contamination and known cancer risks in North County, as it continues to be unknown among many residents in the area. Additionally, the ATSDR recommends that potentially exposed residents or former residents should share their potential exposure with their physicians as part of their medical history. By having an extensive patient history and advanced knowledge of potential exposure, physicians can help mitigate negative health risks. If a patient has known direct contact with or close proximity to contaminated media near the creek and is showing concerning symptoms, early testing and frequent examination may be necessary in order to identify cancers earlier. The Radiation Exposure Compensation Act, or RECA, is one way that these early screenings could be covered financially for patients. Unfortunately, RECA is currently awaiting an extension and expansion bill to pass in the House of Representatives. Physicians in the St. Louis area advocating for the expansion of RECA with their representatives could be helpful in ensuring that RECA is continued and expanded to cover individuals affected by contamination in St. Louis. Finally, physicians can assist in facilitating consultations with medical specialists in environmental health. If you wish to have a consultation with an environmental health specialist, please contact Coldwater Creek at cdc.gov or call 1-800-CDC-info. Here are QR codes that will take you to a site that provides more information about Just Mom's STL, an advocacy group bringing awareness to the radiation in North County, and QR codes that will take you to the reports by DHHS and ATSDR. Thank you.